And for millions of Americans this morning, open enrollment is here. Healthcare costs are rising, with the average family of four spending more than $10,000 on medical expenses. Plus, nearly 40 million American families are saving virtually nothing for retirement. In this morning's Eye on Money, CBS News business analyst Jill Schlesinger looks at how to take charge of that. Jill, good morning.
Good morning.
Okay, we're in enrollment time. How does someone decide whether they should keep his or her health plan?
Unfortunately, requires a little bit of work. You want to look back and see what you spent last year on health care, and you want to project what's going to happen this year. So you ask yourself some questions. Was I diagnosed with something that's different? Do I need to go to a new doctor? Would that change whether I should be in an HMO, a health maintenance organization, or a PPO? Remember, with an HMO, you've got one doctor kind of controls where you go next. PPO gives you more flexibility, but it's usually more expensive. But again, these costs are rising. You really have to take a close look at what's going on in your life and pick the best plan for you.
And we should drill down because there are changes. I'd always just check, whatever I did the year before. That's not very smart.
Well, I know and that's usually what most people do, and that's why we're asking you to do
That's what most people do.
It is,
No,
it's true. And it's the path of least
Okay.
resistance, right?
Yes.
And what's really important here is that there are ways to save some money. We've got a lot of large employers that are introducing new plans. They're called high deductible plans. Means you got a big deductible, right? Mm-hmm. But you actually pay less in premiums. They pair that with a health savings account that allows you to put money pre-tax away. This can be a great option if you're young and healthy, you want to limit the amount of money you're paying. But I should also mention, we've got flexible spending accounts where you can put $2,500 a year away pre-tax. People are not using these ways to save money, and we really need to do that.
I think you just go see Oprah and do what she does.
It seems to have worked for her, hasn't it? That flex spending, totally confusing to me. But the 401 retirement plan, how much should we be putting in that?
You know, most people...
I pay attention to that.
I know, you like that. Okay,
Yeah.
so, well, most people will say, I put up to whatever my company matches.
Yeah.
But interesting trend now in corporate America. Many companies are saying we're automatically enrolling our employees at a 10% rate. And in order to actually be less than 10%, you have to opt out. This is a great thing if you can afford it. Many people can't afford it, but the premise here is if we get you doing it and it's automatic, then you won't opt out. You'll just keep doing it. We love 10%. Remember, $18,000 is the limit this year. If you're over 50, you can make a catch-up contribution of $6,000. I know that that's hard for many people, but let's try to get as much into your retirement plan as possible.
All right.
Really good information.
As always, Jill Schlesinger.
Thank you.
Working with the Voya team again. Thank you. Good to see you.
Thank you.